Straight ahead on Action News, we are talking about podiatry today on Ask the Expert. Dr. Corey Russell, he is here in studio, ready to take your questions. Give him a call, 419-534-5430. Thanks, Kelly. Well, he made the trek in the rain. We're talking about podiatry today on Ask the Expert. Dr. Corey Russell, he is here to take your questions. Give him a call right now. He's waiting to hear from you. 419-534-5430. But first, get out those tickets. Your foot health is our topic today on Ask the Expert. Dr. Corey Russell joins us now with answers to your questions. He's even giving out some advice right here in the studio. Good morning to you, Dr. Russell.
Good morning.
The first question is from one of our viewers. It says, I've been told I have a ganglion, I think I'm saying that right, on the top of my foot. So first off, what is it and how's it treated?
Well, a ganglion is a type of cyst. It basically is a fluid-filled cyst that we typically see on the top of the foot. One of the more common cysts you see in the foot. Usually comes off a tendon sheath or comes off a joint capsule and forms this pocket of fluid. Usually it has like a gelatinous core to it. So sometimes we try to drain it, but it usually doesn't work too well just because of the consistency of the contents. So a lot of times we have to surgically remove those cysts. You make sure you get the stalk of the cyst so the cyst doesn't come back, because there's a prevalence to that.
Okay. Well, here's another question that tends to happen a lot when we see some of that storm damage, maybe things ripped off the side of the house and then they're laying around. This person stepped on a nail that went through the tennis shoe and now they have a little wound. They want to know if they should be seeing a doctor.
Well, it sounds like they have a puncture wound, which, yeah, probably they should see a doctor, because there's a couple concerns with that type of wound. One is you want to make sure you're up to date on your tetanus status, because that can be a serious issue. Additionally, you want to make sure that it doesn't get infected, so you want to cleanse the wound, use a little antibiotic ointment on there, and sometimes we'll use antibiotics prophylactically, especially in that kind of injury, to prevent infection from occurring, because that can be very serious.
Okay, we have someone else who wrote in who's a diabetic and says they're having some numbness and tingling in their toes. They want to know what that is and how they can treat it.
Yeah, this is a common complication we see in diabetics, what we call diabetic neuropathy. And basically the nerves have been damaged as a result of elevated glucose levels, elevated sugar levels that you get with diabetes. This typically happens over a period of time. It usually starts with a little numbness, tingling. You can have burning pain, shooting pain, stabbing pain. And usually there's different medications we use to treat those conditions. Usually most of them are for pain, to control some of the pain and some of the other symptoms associated with that disease. In addition, we use one medication that actually helps to regenerate some of the nerve endings, which can return some of the feeling and sensation in the toes and in the feet.
Okay. Another viewer says that they have one leg that's longer than the other, and this was because of a previous injury. So what can be done to address that issue?
Yeah, it depends how much the difference is between the two legs. We typically order x-rays to get an exact measurement of the difference between one leg and the other, so we know the exact difference. And based off that, we figure out whether they can go with just a heel lift in the shoe, which will equilibrate the limb length, or if we need to add something to the sole of the shoe, which runs the full length to balance them. Because if there's a limb length difference and it goes untreated, that can lead to ankle issues, knee issues, hip issues, back issues, and of course foot issues.
Kind of a trickle down there then. All right, and one more question for you from one of our viewers. It says they get the same rash on their feet every single summer. So they want to know, why does it happen and how they can prevent it, even though I guess they're not saying exactly what that rash is.
Yeah, we have to see it, obviously. Usually rashes that occur more frequently in the summer is like an athlete's foot type of rash, which is a red scaly rash. Obviously it's itchy. More common in the summer months because it's warmer, there's more moisture, they're around pools and things like that where they can catch this type of fungal infection of the skin. Prevention: spraying shoes with Lysol helps. Keeping the feet cool and dry as best you can helps. You can even use an antifungal powder in the shoes. Keep your sandals or flip-flops or something on when you're around the pool to help reduce the chance of spread.
Okay, some good advice out there. Doctor, thanks so much for coming in. Have a great Sunday.
Thank you.
Next week on Ask the Expert, Dr. Robert Heisel.